As the Wuhan coronavirus spread to the rest of China and the world, Metro Vancouver allies of the Chinese Communist Party responded to Xi Jinping's call to send medical supplies. In January, Chairman Yang Tao-Chen of the Canadian Alliance of Chinese Associations sent $150,000 worth of masks, gloves, and clothing from Canada to China. On February 12th, Chen was photographed with Chinese government officials to donate 1,400 cases of personal protective equipment worth $500,000 to Sichuan province in China. Who is Chen? He is an ally of the Chinese government who attended the March 2019 National Congress in Beijing. Last October, he traveled to Beijing with Hilbert Yu, head of Vancouver's Chinese Benevolent Association, to celebrate 70 years of Chinese Communist Party rule. Chen and Yu represent hundreds of businesses and cultural groups in British Columbia that are affiliated with the Chinese Communist Party's United Front Foreign Influence lobbying program. Chen and Yu are mainstays at events with China's Consul General Tang Qiaoling and federal, provincial, and civic politicians in Vancouver. After Chinese factories shut down early this year, the Chinese government sent a call to consulates and embassies seeking help to buy more supplies. In Canada, the Trudeau Liberal government also announced a 16-ton donation on February 9th. That was 2 days after the head of the World Health Organization sounded the alarm about PPE shortages.
The world is facing severe disruption in the market for personal protective equipment. Demand is up to 100 times higher than normal, and prices are up to 20 times higher. This situation has been exacerbated by widespread inappropriate use of PPE outside patient care. As a result, there are now depleted stockpiles and backlogs of 4 to 6 months. Global stocks of masks and respirators are now insufficient to meet the needs of WHO and our partners.
By late March, Canadian hospitals were suffering shortages of PPE, and British Columbia's provincial health officer expressed her concern.
We now have increasing numbers of people in hospital, and that is going through way more personal protective equipment than we expected. So we are on a tenuous level right now.
We're working around the clock to get Canada the resources we need. In the next 48 hours, we will be receiving a shipment of millions of masks by a chartered cargo flight. We're also working with provinces to transport their medical supplies when possible. Items ordered by Quebec will be on this flight. Our government has also leased a warehouse in China to help collect and distribute these items as quickly as possible.
Vancouver's Chinese consulate was already coordinating distribution of masks and gloves to Chinese high school and university students. Bank of China and Huawei made donations to Canada, which raised questions about the ethics of taking donations from companies that the government also regulates. On April 3rd, Chinese consulate officials held a ceremony with local students at the Shaughnessy Consular Mansion. It was attended by a TV crew from Omni in Phoenix. The consulate also donated 500 N95 masks to Vancouver General and St. Paul's hospitals. Then Yang Tao-Chen and his United Front allies made a mass donation with $24,000 in checks and more than 36,000 masks and almost 1,700 pieces of clothing to hospitals in Vancouver, Richmond, and Burnaby. Chinese supplied masks and other equipment have not all passed inspections. There have been widespread recalls in Netherlands, Toronto, and Ireland, where former UFC champ Conor McGregor slammed China on Twitter. Vancouver Coastal Health spokeswoman Carrie Stephenson refused to comment on the specific donations. BC Health Minister Adrian Dix gave an update on PPE at his April 9th news conference, where he said BC had bought or received donations of hundreds of thousands of masks, tens of thousands of pairs of gloves, and thousands of gowns and coveralls.
We're getting PPE from a variety of new vendors and suppliers, in particular in China. Importantly, we're taking our time to inspect and test any and all PPE that comes into BC before it gets near the healthcare system. This is a normal and expected process.